Hi, this is Dr. Fox. I'm a licensed psychologist in the state of Texas, an expert in the area of personality disorders. And in this video, I'm addressing a concept called complex BPD. Now, there is, in a lot of the research, there is something called pure BPD. And pure BPD and complex BPD are very, very different. And I think that there's a lot of confusion associated with these two types. Now, if you search for complex BPD, you're not going to find it. What's going to come up? It's going to come up as complex PTSD, and that doesn't mean it's the same as BPD. But it's important to recognize that what I'm talking about is complex BPD, and what we're going to talk about in this video is making that distinction. And I'm going to talk about the different aspects of the disorders. And this is all information that I'm going to be putting out in a new book that I've been working on, and that's going to address pure BPD and complex BPD. Because I think what the mental health field needs to recognize is that we keep looking at BPD as a singular entity to try to then explain all of the individual symptoms. And that is just not the case. Is that I talk to a lot of folks that they'll call me for consultations and things of that nature. And we're talking like, well, that's BPD, right? But there's so many other facets. A lot of times it's PTSD. Sometimes it's complex PTSD. Sometimes it's depression. Sometimes it's bipolar disorder. Sometimes it's psychosis. So there's other components. So I think having a term that can better encapsulate the variability inside of BPD, I think would not only do the field a service, but also those clients that are experiencing it. So let's get into it. Let's talk about it. I'm also going to, I have two comments. I did post something on my YouTube channel for folks to respond to, and I asked them what they thought about this idea of complex compared to pure BPD, and I'm going to read some of those later as well, and we'll go through the different aspects. So let's get started. Let's talk about it. Okay, so pure BPD. This is in individuals, and it's very rare. It's about between 3 and 7% of those that are diagnosed with BPD have what's called a pure BPD. Now, pure BPD is only BPD symptoms. They don't have other components. They don't have there's no other comorbid disorders. So it is just pure, it is BPD. Now the complex BPD, which is much more common, okay? Now these individuals also meet the criteria for other disorders such as depression, bipolar disorder, ADHD, narcissism, antisocial, dependent personality disorders, as well as obsessive compulsive disorder, and as well as others, but these are the ones that are most common. And there's so much confusion because that complicates the clinical picture so much. And I think mental health providers, as well as the individuals, are very confused with what they're working with. And these components directly relate not only to accurate diagnosis, but certainly to treatment as well. So we need a better term to identify and describe this type of BPD. Now, some of the components in this upcoming book that I'm going to talk about, this includes like origin and history. So are they different? Well, there is no one singular trajectory that accounts for the development of really any disorder, and that includes BPD. Certainly BPD, and the folks that I've worked with, there's certainly more of my clients as well meet this complex BPD. That how they ended up developing this is very different. Some have experienced trauma very early, some have experienced trauma very late, some have had neglectful homes. Some of them, have had these varying experiences. I won't go through all that today, but it's complex BPD. So we don't want to get caught up with where, what is the one thing that's causing this complex BPD? Because it is complex, because there are so many working parts, that there are many routes that drive the ultimate manifestation or development of this complex BPD. Now, What about affective misdiagnosis? Certainly. Now let's use depression. So depression and BPD, I've done a video on that, is very, very complex and very, very confusing for a lot of folks, because the depressive episodes often severely impact BPD, right, as you can imagine. But as far as treatment goes, we have to treat the BPD and not the depression, because what happens is that the depression is driven by the BPD. It is not the depression that is driving the BPD. So you see where this confusion is, because if you have a treatment provider who only sees the depression, maybe they haven't realized, or they don't want to work with, or they don't want to see the BPD components. What happens is that then they're like, okay, well, it's a depression. So maybe the client is on Zoloft or Prozac or whatever it is. And then they're like, well, how are these episodes of abandonment and the sense of emptiness is not attenuating? So you need a stronger medication. That all that does is increase the side effects. So what you need to do is address the BPD core contents, right? And if you've read my workbook, or if you've seen my other videos, that I talk about core content and surface content, and about addressing that issue, about addressing these issues. Dealing with these affective expressions is critical as well in managing these issues. And I think sometimes what also happens, and certainly I'll talk about this as well in the upcoming book as well, but is that I think a lot of times individuals with BPD, that they'll go in and they also have comorbid bipolar disorder. And the practitioner is like, well, if we treat the bipolar disorder, then all the borderline traits and components and issues, those should attenuate as well. And in some cases they do, and in some cases they don't, but we know that medication doesn't treat personality. So what happens is then you end up with more confusion, you end up an increase in dosages, and then the individual has more side effects, and then they end up with different medications and so on and so forth. And this happens with all of those disorders that I talked about, because it is the BPD that changes the expression, manifestation, and treatment of what I'm calling this complex BPD. Now, that doesn't mean we're going to dismiss the other diagnoses. We're not, but we're going to address them together. We're going to address them as separate components, but also not just see them as separate components, but see them as a whole part of the individual. Now, if that sounds confusing, so let me give you an example. So if someone were to come and see me, and let's say, right, they meet criteria for depressive episode, but also, or a depressive disorder, right? Major depressive disorder. And the depressive disorder is recurrent, and we'll say that it is a moderate. And then you have obsessive compulsive disorder. So you have the obsessive compulsive disorder, you have the major depressive disorder, and you also have borderline personality disorder. And when we look at this, so we need to look at, okay, let's look at what's the core components. What's driving it? Is it emptiness? Is it abandonment? Is it the sense of invisibility? Now, how does the depression factor into it as well? And if this is getting overwhelming and confusing, it's hard to do this in a short video. Recognize I work with folks for a very, very long time. And what we do is we delineate these different symptoms and how they present and what's driving them. Because in some cases, they do need medication if the major depression or the OCD is at a moderate, high, moderate, severe, extreme level. And then we'll work with the BPD, but we see it all as factoring in together, that this is what this individual is dealing with. How can we develop some strategies to deal with the OCD? And if the obsessions and compulsions are so great, but we see that it happens during particular depressive episodic phases, as well as when there are issues of abandonment, then we have to work on those components as well, and find and develop adaptive strategies. If this is confusing, that's because this is a complex BPD. And what we need to do is we need to find ways for individuals to certainly identify symptoms that are present, what are triggers or emotional buttons, and if you've seen my video on that, that's also a chapter in my workbook as well. I'll put the link for that video here. Then you know what I mean. So it's identifying those things, identifying these different factors. so that you can increase insight and develop adaptive coping strategies that can help you do things differently. Okay? Now in looking at all of this, I think that this provides a good sense of the complexity of BPD, and that's why I think that a book or a video, I think it's hard to put everything into the video, because I think that we're working at my pace in a video. As hard as I am trying to keep it at your pace, I think that that's very difficult. That's one of the benefits of workbooks, is that you can work them at your own pace and do it at a pace that is beneficial for you. So for me, what I'm trying to do is convey the complexity. And I think a lot of folks who have experienced BPD understand that it is a complex disorder. And I think a lot of folks who have treated BPD or individuals with BPD recognize that it is a complex disorder, because pure is so rare, and that it does impact, the interaction patterns and how you see the world and how you see yourself, because it is complex. And I think that we need to give it an identifier that helps the individual as well as the practitioner. So let me just read a couple things that were posted in the community when of my YouTube channel. You know that YouTube has this community thing, and so I put it out there. Let me just read some to you so you can get an idea, and I'll answer some of their questions and concerns here. Okay, so this one here, this is from a young woman who wrote, maybe you could discuss how sometimes the symptoms of two comorbid disorders can also present as a single disorder and vice versa. Also, how the misdiagnosis can affect patients long term. For example, I was diagnosed with bipolar disorder and anxiety in my early teens, but upon further testing and work with my therapist, we determined that it was actually BPD and anxiety, a complex personality disorder. All right, a whole 6 years later. Love your work. Thank you. But you see, and I really think that this delineates, many folks who are watching this video have had a similar experience to this individual, which is that initially it starts out with, oh, well, that's bipolar disorder. And if you've seen my video on bipolar disorder and BPD, you know that there's a lot of overlap, that there's a lot of confusion about the distinction between bipolar disorder and BPD. But if they co-occur, and they do co-occur, it's a complex BPD. It's a complex personality disorder. And having that option, I think, helps the individual and the mental health provider have further understanding that this is a complex case. This is a difficult case. And I think that what I'm also trying to do is prevent people from just writing off these additional symptoms and say, well, that's BPD. It may or may not. We have to get in our brains that individuals with BPD, there's a 93% likelihood that they have a comorbid disorder. So we have to look for both. One is not going to account for the other. Sometimes they both coexist, just as this individual wrote as well. And let me read one more. Okay, so what this individual wrote is, so you're obviously most likely only going to see the illness that brought me to breaking point and what I'll complain about most in the moment as something to work on. But once the intensity of that illness lifts, you start to experience the symptoms of other underlying ones more. Absolutely true. Or at least in my experience, I have depression and BPD, with depression symptoms that become more present when I'm suicidal than BPD traits. But as soon as I'm not depressed, the BPD traits come out to play, which cause me to become depressed again, and it's a never-ending destructive cycle. I find it very frustrating for health professionals to dismiss that because you never get better in the end. I need help with all of my symptoms to eventually be functional, and that is exactly what I'm talking about. A lot of folks wrote something very similar to these things, that it is this recognition of the complexity, that it is a recognition of how BPD manifests. And we have to recognize that comorbid conditions are at a exceptionally high likelihood to also coexist. And that once it lifts, see, what I like to do with my clients is I like to empower them, right, at the end of the session, empower them with those positive core content factors that they have, so that when they leave, they feel empowered and they feel good, so that they come back even when they're when they're feeling good. Because I've heard from so many clients over the years that have said, I hate coming to see you because you ruin my day. And so what do when they're having a good day? They don't come to treatment because they don't want me to ruin their day. So I realized this a long time ago, and I said, okay, I need to make these sessions positive, empowering, encouraging for folks. And that is what I've done. And I think that probably 90 or so % of all my clients end with an empowerment, with something that they feel good about themselves, things that they've achieved or accomplished or managed or something they've done. Because I genuinely am so just impressed with a lot of my clients, the things that they deal with and the things that they manage and all of these things. And it's just that they're able to do it. And I think that we need a term that captures the complexity of BPD. And that is why as I move forward, you'll hear that term more often in my videos about complex BPD. And as I go out and I do these seminars, I'm going to start talking about pure as compared to complex BPD, because I think that we need to make this distinction so that we're all aware of the co-occurring conditions and not lump everything together, and recognize that when our clients are doing well, that we want them to come in, because that's really when we can get into the stuff, that it's not ruining your day. That's when we can get into the stuff, because when you come in distress, we have to decrease the distress, and we only have so much time in session. So we decrease the distress, then we have like 15 minutes left, and that's when we want to start doing empowerment and encouraging and all these other things. So it's so important, I think, to be sure that you're going to sessions when you're feeling good also, but also leave feeling empowered. And I hope that this video has increased your insight and makes you feel empowered and good about managing this complex disorder that we're going to call complex BPD. So thank you very much, and please like, share, and subscribe, and have a great day. Thank you. Bye-bye.